with mental illness. Kenton Beachy, Mental Health America Franklin County, is acting as the host agent for this group's continuing work. We will continue to use best practices identified by the Suicide Prevention Resource Center, which include engaging individuals with lived experience, increasing partnerships, collaborations, as well as using culturally competent services. Another important aspect of suicide prevention is also suicide support for people that have lost members of their families to suicide. It's a tragedy that has a far-reaching effect. With the number of suicide deaths on the rise, the needs of this community continue to grow. Research estimates that each death by suicide impacts an average of 147 people, 6 of whom will experience a significant life disruption. We recorded 188 suicides in 2017, impacting nearly an estimated number of 28,000. With the increasing rate of suicide, the community of survivors continues to expand. Franklin County Loss is made up of trained volunteers, many of whom are survivors of a suicide loss themselves. They exist to be an installation of hope by providing resources, understanding, and support. They support the bereaved by suicide as first responders and through the months that follow. It's a model that is based on peer intervention. It was developed by Dr. Campbell, licensed clinical expert in the area of suicide. The goal of this model is to expand a suicide survivor's knowledge of and access to resources and decrease the length of time between the death and survivor seeking bereavement. I can also tell you that we get strong support from the Franklin County Sheriff as well as all the police departments that when a suicide is discovered, that loss is contacted so that we can begin that process. It's not only a process at the time of the suicide, but it continues to be months afterwards. We believe very strongly that, that while the initial impact, we want to work through that process. Loss also continues contact and develops an ongoing relationship with that provider or with that family that has lost someone to suicide. Another aspect of community, our mission is community education and anti-stigma. Despite the increase in conversation and media coverage about mental illness, the diseases are still prevalent in our community and treated differently than physical diseases in the media, in the community, and the homes of Franklin County families. That's why we invest in prevention and community education and why we believe it is so important for a successful community. This past year, we launched a new campaign called Denial Ohio. We work closely with business, civic, and community partners to form the Ohio Opioid Education Alliance. The main goal of the alliance is to educate parents and caregivers about the risks of opiates to decrease the number of young people who misuse prescription drugs. This media campaign is also a result of the Opiate Action Plan and a call out for the need for community-wide public awareness about how to prevent opiate use and save lives. Let me also thank you for your continuing support of this initiative. This is probably one of the most substantive initiatives that we've undertaken, at least during my tenure here at the board, and we could not have done it without the leadership and support of many of the corporate community, especially a thanks to the Nationwide Foundation for their leadership. We frankly believe that there are 2 things that every citizen can do. One, if you have a child, talk to your child. We know that when you talk to your child, there's a 50% chance that there's going to be a reduction in the risk of future opiate use. And the second is dispose properly of opiate prescriptions. It's important that we decrease the availability of opiates, especially those that are unused and happen to be sitting in medicine cabinets. This research that we undertook in partnership with the Nationwide Foundation was interesting in that when we did the quantitative and qualitative research, we found that most people agreed that there was an opiate crisis, but only 1 in 5 believed that it would ever affect their family. That's the same rate as what people believe would be an airline disaster for their family. That's how much denial there is that it could touch their lives, and that's why the campaign, I think, resonates with so many people. Another practice that we undertook this year was the Youth Mental Health First Aid. We found it's important to recognize that our mental health first aid initiative has really been focused around adults. But the reality is that, as you can imagine, many young people suffer from mental health, anxiety, depression, stress, etc. So we've undergone the process of training young people how to be a better responder and helper when they do see someone struggling, and how to refer them to get the appropriate help. These individuals increase their knowledge of the signs and symptoms of youth mental health and substance abuse. And in addition, their families are assisted by those trained in youth mental health first aid as a benefit to the society, as well as obviously our school community. Finally, I wanted to talk a little bit about the 2019 initiative. As the population of Franklin County continues to grow, the need for emergency psychiatric services continues to increase. NetCare and other local emergency rooms are overwhelmed by the people in need of help. In 2016, the Franklin County Psychiatric Crisis and Emergency System Task Force released recommendations to improve psychiatric emergencies in system responses in Central Ohio. We believe creating a comprehensive collaborative system of crisis care for people experiencing mental health and addiction emergencies is the main recommendation of that report. With that recommendation in mind, our main priority is to break ground on a new facility in 2020 to better address the needs of people experiencing these crises. This is an aggressive goal and will require the collaboration of many community stakeholders. We're especially appreciative of you, the Commission, as well as the County Administrator, in your support of building a new psychiatric emergency center in Franklin County. Because this initiative is still in the initial planning stages, Adams' 19 budget request does not include the funding for this project, and we look forward to providing you with updates as the plan progresses and bringing a resolution for your consideration as the plan matures. Let me also share with you that the hospital systems are committed to being active partners in creating this solution, and we believe with their active support and involvement, along with the involvement of county government, that we can create a emergency psychiatric response center that will meet the needs of the community. It's the one place I think in this system, there are many holes, I suppose you could say, in our system of care, but nothing is more dramatic than the need for us to expand our capacity and our thinking about how we approach psychiatric emergency. And with that, I'll be glad to answer any questions you may have for us. Thank you, sir.
Thank you, Mr. Royer. I really appreciate you being here today. I want to open it up for comments or questions from my colleagues. I have some too, but.
I know as you talked about all of the different pieces of the plan, the Opioid Action Plan, and all of the parts of the work that you're doing. You talk about recovery housing, and you've been funding the level 3 housing. We know in our community there are many sober homes and homes that put themselves out for people to live in that call themselves sober homes, but are they really, and is there a definition of what a sober home is for those that need that? And I know what you're doing is very different than what some of these homes are doing. How can you, as the Adam Board, take a look at that?
Well, we differentiate recovery housing from sober housing. We think it's an important nuance because of the accreditation issues. And not only do we do level 3 housing, but we also do level 1 and level 2. We've been doing actually funding recovery housing now for the better part of probably 5 years. Yeah, 5 years. Sober housing is totally unregulated.
I know.
I've had discussions with the Ohio Department of Mental Health and Addiction Services. We unfortunately have read some of the stories of some of the issues surrounding these sober houses. I've asked them directly that I believe that they need to start to form some kind of review process to do regulatory, some kind of regulatory compliance on these homes. Unfortunately, the current administration has indicated that's not something that they're interested in pursuing. The Ohio Department of Mental Health and Addiction Services, they do not offer accrediting standards for either recovery homes or sober housing. They do obviously do certification and licensure for treatment and prevention. I think it's a whole. That's why we've chosen to always partner with our existing nonprofit community, because we know the leadership, we know the quality of leadership that we get out of our nonprofits. But clearly it is a gap, and I'm hopeful that the next administration will be more willing to take that on.
Yeah, we've seen it as a gap and a dangerous one for some of our residents that really need to be getting the treatment that they need. And some of these homes that bill themselves as safe places really are not. And I don't want us to let that go without some kind of regulations so anything we can do to be helpful.
Thank you. I think it's, I think there are folks that are operating sober houses that are of high quality and high standard. Many times they're recovering themselves, and they do it as part of their own mission of returning back to the recovery movement. Unfortunately, we also know that there are people that exploit opportunities, and I agree. I think for us, because we don't have regulatory authority or certification authority, that's why we've always said we will work with the nonprofits that we know and feel comfortable with. Bad things still happen, or can happen, I suppose. But we think that that's one way that we can do the best we can with the powers that we are given, or to address the issue that you raised. But it's a legitimate concern, and I'm hoping that it'll be addressed by the next administration as they look to leadership in trying to address the opiate issue.
David, we've, it's been what, I don't know, we've been down the road with the opiate action plan now for a bit. We spent a lot of time, we spent some dollars. We've had a lot of people around the table. How do you think things are going? What do you think, how do you think this thing's working for us?
I guess, in a couple ways, I think things are going, they're going okay. I'm not going to say it's a rousing success, and the reason I say that is that all too often our stabilization center is filled, unfortunately, and we know that people are still dying. But I do think in the long run we will continue to work. I mean, I really believe that there's a couple issues here. One is when people lose hope, and all too often people that are actively addicted to opiates have lost hope. They've lost their way. I think it's about how do we regenerate quality of life for these individuals, both in an economic status and a poverty status, but also just believing that there's a better way. I think prevention and our community education initiatives will pay off, but those are going to take time. I think the partners are working together to address it, but I think that over time we'll make some inroads, but I think it's way too early to believe that somehow we've turned a corner. And I don't want to be negative about it, I just want to be honest.
Well, I didn't ask you the question thinking that we had magic bullet or that we address this issue in just a short amount of time. I think that's kind of silly, and I think that
Yeah.
there's people out there thinking that should have been the answer. I think we've had folks in the media that have looked at this and said, oh, look, they spent a lot of money and we put this together and all these partners came to the table. And I think that there are even folks in the media who thought that we should have had an answer by now. And I think it's just kind of silly. This problem is enormous, and it's way too big for us to have had some sort of gigantic impact in such a short amount of time. We knew this was going to be a long time. We knew when we filed the lawsuit that we filed, last year, not even a year ago. We knew that this was going to be a long haul. We knew that this was going to be something that was going to take a long period of time for us to be able to make an impactful. Now, don't get me wrong. We know that we need to make an impact right away, but there are some of these things that we're working on that are going to take a period of time. That some of this recovery is going to be a long time. That some of these people's lives are going to be impacted right away, and some of these people's lives are going to take a long time to be impacted.
Yeah.
And that some of these issues, I mean, we're talking about generational stuff here.
That's right.
In terms of some of this recovery, and so I think for folks to have an expectation that we came together, we threw a bunch of money at this, and therefore we were supposed to stop this bleeding, instantly, was just kind of wishful thinking, and that this is a problem that it's something that is going to take time. That some people are going to be impacted immediately, some people are going to be impacted in the short term, some people are going to be impacted in the midterm, and some people are going to be impacted in the long term. But
Yeah.
we're going to have to fight this battle for a long time.
Absolutely, and when you really look at the history of some of this, I mean, we got into this over a 20-year period, a 20-year period, and we're drinking, and we're slowly trying to dig our way out. And this is probably the fastest, most deadly form of addiction there is. I mean, you're literally just every day, if you're an addict, you're on the threshold of death. And this idea that so we've just got to keep working it and working and toiling at it. But the most important thing is we can never give up, and we can never give up hope, and we have to keep motivated and believing that we can turn this around. It won't come fast. It won't be easy. It won't be cheap. But people do recover. People live productive and fruitful lives, and we've got to do everything we can to prevent the next generation and treat the current generation of users.
All right. I just want to focus for a quick second on some of your budget numbers, and I want to make sure I understand this correctly. Still being a new guy, I'm still trying to process. It's been a lot to process over the last couple of years, but so you currently don't receive any general fund money from Franklin County. All of your money, if you could just run through the breakdown of where your money comes from and how that's what percent comes from where.
Sure. Roughly 70% comes from the levy, so that's our single biggest source of funds, and it's almost at a $60 million a year collection rate. The rest of our funds are made up largely of state and federal funds coming through the Ohio Department of Mental Health and Addiction Services. But we also do local collaboration with other agencies and bring in funding that way when necessary.
Great, excellent.
Mm-hmm.
And I think this is good for the public too that might be watching. And then also, in looking at your 5-year revenue history, it shows that in 2000 and wait a minute, I got the wrong slide up. Wait a minute. Edit. The bottom line was that your budget has increased. Here it is. Significantly. So in 2017, it was your actuals were at $69 million essentially, but in 2019, they're at $102 million. Can you just explain the
On the appropriation side?
Yeah, that's
Sure.
a huge difference.
Sure. So the biggest thing that's affected our budget over the last 5 years is Medicaid expansion. So we are continuing to work with our provider community to rework how we invest our dollars to complement the Medicaid dollars. So that was really a very good thing for us financially, in that Medicaid, starting through the expansion process and through the reform process, has begun to pay for more services and cover more lives. So we're still kind of in the throes of figuring out how to repurpose some of those monies. So as we do that, our budget has fluctuated first down in terms of actual expenditures because of the Medicaid expansion, and now we're trending back up because we're coming up with new ways to invest, including some of the things that we've talked about here today.
Sure. And that's really important to understand, because I mean that's been such a big political debate in terms of the medical or the Medicaid expansion. And here's an example. While some folks like to zero in on the opiate crisis in a political football arena, if you will, here's an example where now the resources have been generated to really allow us to do some creative and innovative and more aggressive kind of programming. Is that correct?
That's absolutely correct. And just, you know, we talk about it as a game changer. So if Medicaid expansion changes in any way in the next, you know, administration, if you will, including work requirements or anything else that limits our consumers from having access to insurance and care, that's a game changer for us. So we'd be quickly back in front of you saying, all right, the ball has, you know, the game has shifted and we need to rethink our budget. But as it is right now, we're counting on that Medicaid expansion to continue.
That being said, if I could build on that, and I just did this question one more and that's it. But do you have a government affairs office and division that really sort of is proactively focused on engaging with the legislature and with congressional members to just sort of stay ahead? You know, as I think of Franklin County as the largest county in Ohio, one of the largest in the country, you know, our agenda is our agenda. It's not absorbed by all the large urban counties across America or all the large urban counties in Ohio. It's Franklin County's agenda. And I just want to make sure that we're doing everything proactively to advocate, you know, and I think that requires a government affairs strategy, essentially.
Yes, I agree with you, and I think, you know, largely we do reach out. We were able to work with our delegation with Judge Montgomery in creating the guardianship board, which has proved to be of such value for people with mental illness. We will gladly join in with you in your leadership in pursuing a Franklin County strategy. I agree with you. One of the problems we face, I think, is that we don't have an urban vision for Ohio's largest cities, and we need one. And we need an administration, and we need a legislature that supports our urban needs. This is, you know, everybody experiences the same issues that we do across the state, but no one experiences them at the magnitude and the depth and density of the challenges that we have here, and as well as in Cincinnati and Cleveland. We're the epicenters all too often of some of these challenges that we face in our particular line of business. And so anything we can do to join with you in that Franklin County agenda, we will look forward to.
I just said that moreover, it's only going to grow. I mean, as Franklin County, as it's projected to grow, this is going to become more complex. We can take a deeper, more strategic dive, but it's going to become more complex because we're going to double in size over the next 30 to 50 years. So Lauren Rummel is our the Board of Commissioners Government Affairs position. This is a newly created sort of sole focus position, and we'll send her over to connect with your folks and begin to talk strategy and align, and she's been doing a lot of that lately. And so now would be the perfect time between now and early next year to gauge, because we're drafting a Franklin County centered agenda that will help sort of align our needs with the movement of the legislature. So
and
it'd be great to have her sit down with you.
And it's important to recognize that when it comes to issues around mental illness as well as substance use disorder, that concentrations of poverty tend to add the numbers of people that experience those challenges. And so as we continue to evolve as a county and as a city and a community, I think it's we have to recognize that there is a disproportionate effect on some of our poor citizens. The final thing too is that we also tend to be collection points for people with mental illness. In other words, we have higher rates of prevalence because of the resources and the availability. One of the terms, and it's somewhat pejorative, but it gets to the point, is there's a silting where people from other areas of the state will come into our community that may have a substance use disorder or a severe and persistent mental illness. So it's not straight prevalence across the board and throughout Ohio. We do have a disproportionate challenge here in the urban community.
I don't want to take up too much time. We got a lot to get through today, and so I won't. But I will say two questions I'll leave you with. You don't have to answer, and my office can circle back around with you. One, make sure that you're connected in this Poverty Commission conversation at a very deep level with Director Bivens and work we're doing, because I think you hit the nail on the head. And then the second seed that I'll plant to you is with the development of this new correctional facility, there's just got to be some innovative and nuanced strategies that we can take with some of this work. And I'm sure you and Sheriff Baldwin are talking and doing that, but I'd like to be more knowledgeable of that, because the opiate crisis is directly linked to both your divisions.
Thank you.
And it'd just be a valuable thing to, at least for me, I'm sure my colleagues are more up to this than me. I'd like to be a little more in tune with that conversation. So,
Thank you.
yeah, thank you very much.
Thank you.
We'll take, if there are no further comments, questions? Yeah. Okay. Thank you very much.
Thank you.
We'll go ahead and have the next group just line on up, and this will be Justice Programs and Policies. I gotta get some charge here.